Hello, I'm Sarah Anderson. I'm a certified industrial hygienist. I've been doing this work for over 30 years in a variety of industries, starting off in oil and gas, chemicals, and going on to manufacturing and global type operations and international work for the past 25 years. This discussion today is going over one of the projects that I was involved with as a team to develop a global HSE management system for a company that was internationally based, over 100,000 people. They were in over 140 countries with over 1,650 locations worldwide. And at the time that I was hired in as a director of HSE globally, they had no systematic corporate level HSE management systems or programs in place. All of those 1,650 locations had either nothing or something different, so there was no consistency in how things were being managed from an HSE perspective. And we were seeing a lot of losses from incidents and cost of implementing a variety of different programs and tools that were not aligned. And there were gaps in compliance with HSE management and local regulations and company expectations to take care of people and make sure that we were also working in communities safely and preventing harm to the environment. So because there were so many inconsistencies throughout this company and so many areas of potential liability from compliance and the basic harm that we were seeing happening with people because they weren't really managing the risks from a health and safety perspective, the corporate level, the CEO and the C-suite decided it was time to put together a very strong corporate HSE staff, which they had eliminated years ago. And as a result of that elimination of that group, there was an increase in incidents. They had 9 fatalities in one given year, which is nothing anybody wants to experience. So we put together a team of people at the global level to put in programs that were consistent across the board, expected to be implemented everywhere in every country at every location, so that we could get a handle on the risks, manage them effectively, put in the appropriate controls, and make sure that those locations were given the support and the knowledge to effectively manage HSE. So we'll go through some of the details in what we did to make this successful and some of the impacts that it had in this global company. As you can imagine, it's a difficult process and one person cannot do it. So it was very much a team effort with people from around the world in different countries contributing to the development of the programs that were put into place. So as I said, it was a company of over 100,000 people in over 140 countries with over 1,650 locations worldwide. And they were continually growing through the acquisition process. So we'd be buying other companies throughout the year and growing at a great rate with the intention to grow by 50,000 people by the end of 2023 was the goal. So we were growing very fast. Some of the issues that were driving this work and this team included the fact that we had fatalities. Like I mentioned, there were 9 fatalities in one year, absolutely unacceptable. Even the loss of one life is unacceptable. So they did not have life-saving rules in place like some of the companies in oil and gas industry did. So we made sure that was a focus as part of the HSE management system as an overarching expectation. So we developed 12 specific life-saving rules that were pertinent to this company's work and work that was similar in other industries. So there was a real strong basis for the development of the HSE life-saving rules and a reasoning behind that. And it included the development of the guidelines, the expectations for employees to follow them, and also consequence management. So people understood it was not an optional thing, it was an expectation and a basic requirement to follow these life-saving rules. So we developed those as part of the overall program. And then we also developed the HSE management system because they did not have any corporate level HSE management system to drive consistency throughout the organization and simplify things, because as you know, there's a great cost involved. If every single site's developing their own type of program, there are all these people just spinning the same wheels. And for what purpose, when you really need just one universal program that's at a level where you can apply it to each country and make it customizable to make sure that each of the country's regulations are compliant within that global system. So that saved a lot of time and a lot of resources. So instead of having people in every country and every site developing these programs, we had one corporate level team developing it for everybody. And then we effectively rolled it out by country through specific training plans and programs. And we also translated those documents into 10 different languages. As I said, very large company, globally, and we were able to provide translation of all the relative materials so that we would save that cost down at the country level. So that was something that was absorbed by corporate to show them how much they were investing in this and how important it was to make it hit home. So when I came in, there was also no global tools in place. So there are a lot of tools that you can put in place and develop or buy off the shelf to help implement the overall HSE management system, like document control, safety data sheet management software, incident tracking software, very important from an HSE perspective to be able to track what is happening, where it's happening, so you can pinpoint potential areas to improve upon and focus on to eliminate and manage those types of incidents from happening again. So having that global visibility through these tools was extraordinarily helpful to the C-suite, and the CEO was very concerned about how things were running within this company, but had no real visibility and no consistency in reporting. Everybody seemed to be reporting incidents differently, and having this kind of management system in place allowed everybody to be reporting the same types of things with the same expectations. So we could compare the apples to apples versus apples to oranges, which is very important in analyzing the data and improving performance. So doing an analysis and a review of what was in place and what was not in place, we found that there were some countries that had certain systems in place that were doing the same thing but were different providers. And we were spending a lot of money on these things with multiple options. In one case, we had SDS management systems in the company. There were over 27 different kinds of safety data sheet management systems in place in 27 different countries. Some of them were developed in-house, which took a lot of time, resources, and money, and then others ones were bought off the shelf. And when we did a review and analysis of the cost of all of those 27 different options, it cost more to have those 27 different things in place than having one global system that allowed us to manage SDSs consistently in every country that we were in, and have one platform to review the safety data sheet management and the archiving management, and making sure that we were compliant with the regulations that were globally expected to be complied with. And it also provided us more detail on printing out labels. We had had some issues with non-compliance with labels, which resulted in fines of over $50,000. And by having this global system put in place that was applied in all the different countries, we eliminated that risk by having a system that provided the appropriate labels to be compliant with the regulations in those countries. So we eliminated that fine and that liability and that risk. And we also saved over $250,000 a year by going to one global platform just with this one tool and eliminating the 27 different options off the plate. So that was a direct win monetarily wise. We saved a lot every year based on that consolidation. Some of the basic HSE performance issues that we were reviewing and finding out more when we hired into this company and were developing the programs were, the 9 fatalities in one given year, very inconsistent classification and reporting of incidents globally, so we didn't have that apples to apples and apples to oranges kind of comparison. And there was a great lack of understanding of HSE throughout the organization about, what hazards did they have? What risks should they be concerned about? What was their liability? The corporate level had no visibility of any of that when things were being managed at the site level in each country, and people weren't reporting upwards for the company to understand what the risk was and where they needed to focus to eliminate and manage those risks. Um, and by having the global systems in place and global tools in place and consistency in reporting, it gave the global corporate level a view of what the risks were. And then the team, the corporate HSE team, was able to put together different programs and different initiatives to focus in on those areas that were identified of concern that were causing harm to people or the environment or the corporate reputation. So in order to manage things and implement an HSE management system at a global level, you have to have a lot of different elements involved to be successful. So first off, you have to have the support of upper management to ensure that they give you the resources and the time and the money and the tools to develop these things, and have the time to go and conduct the training, because you can't just write programs and put them on a shelf. You have to make them active and implement them out in the different locations where it matters. And the people have to implement the different tools. So it took a lot of time to translate the materials, go out and conduct the training with all the different HSE managers and the site management so that they had ownership of implementing the program, so they knew that they had to have resources dedicated to doing and implementing and training on these different systems. And in order to be successful, we had to get buy-in from the different regional country managers, the different business line unit managers, because it meant that they were going to have resources dedicated to implementing and training and conducting the implementation in their locations and in their countries. So before we could even launch it and start our work, we had to get buy-in and understanding from all these different stakeholders so that they would support it when it was time to roll it out, and that they would have the resources there to do that to help us. It was a very lean team. There were 9 people from the corporate level HSE department that worked on this whole project that was start to finish, developing and writing all of the different programs, all the training materials, scheduling the rollout, and then also looking at the global tools that would help implement and manage that going forward. So one of the key things to make it successful beyond having the support of upper management is hiring the right HSE professionals with the right experience and credentials to make the program successful. If you don't have those people that really understand the details behind HSE management, industrial hygiene, for example, you're going to have serious gaps in the understanding and implementation of those kind of programs going forward. So making sure you have the right staff is very, very important in the success of any HSE management system. And then identifying the right tools, making sure you consolidate them, having a universal tool for the different areas of concern saves the company a lot of money and increases visibility and standardizes everything from reporting of incidents to the management of the controls and the closure of corrective actions, and having that visibility to make sure that it's being done. Included in the implementation of this project, beyond the written documents and the selection of the universal tools, we created a SharePoint page that was accessible by everybody in the locations so that they could get those materials that were being developed and translated in their languages. So we had a dedicated SharePoint page for the life-saving rules, as well as the HSE management systems. And we had links on that page to all of the tools that supported all the different programs in the HSE management system. Again, adequate and appropriate staffing, very important. Once we finished the development of the management system, rolling it out and training the trainers at the different countries and the different sites, and also providing training on the different tools was very important. You can't just put a link out there and expect people to understand how to use it. So there's a lot of hands-on training and a lot of training that we did face-to-face to get that understanding and to make sure that they really understood how the expectations were for the implementation of it and how to use the different tools to help facilitate the implementation. The people that were involved in developing the tools as well as the HSE management systems came from all over the country. We had representatives from Australia, Austria, Canada, Crete, Philippines, Portugal, the UK, and the United States. So we had a good global representation so that we didn't miss things that might be managed differently in other countries, and taking that whole global view into perspective. We developed a lot of visual materials to help with the understanding and learning of the management systems and of the different tools that we had so that they could understand how they were supposed to work, what was supporting the different factors of the HSE management system, and the different elements of each of the systems. Because like the safety data sheet management system wasn't just to manage safety data sheets, it also provided the labels to print for local use and also for shipping that were compliant with DOT requirements and the air freight requirements. So, training on all the elements so that it was used effectively and to its utmost was also very important. Software systems, we found that having cross-functional teams involved in the selection of software systems made for a more successful launch and better ownership. So when we were looking at the safety data sheet systems, we looked at about 7 different vendors. We looked at ones that were currently in use, and we looked at the comparison of all those different options to what we needed as a global company. And then we had the business units look at them and weigh in on what would work for them. So we got a solution that the end users were involved in selecting. And we did the same process for the industrial hygiene and medical surveillance system that we ended up putting in place, and the incident management software. So having people from different lines of business and different functions like purchasing, procurement, very helpful in making sure you got the right tools at the end of the day. And basically, the implementation timeline for this project, it was a few years from start to finish, and some elements of it are still ongoing with further development of the software tools that are in place and with the deployment of them. For example, the industrial hygiene program that was selected and designed is still being implemented and launched in countries even today. So, we started with a game plan of 10 countries that had stringent requirements for industrial hygiene and medical surveillance, and it's being rolled out to all the other subsequent countries over time. As far as the benefits goes, we reduced the fatalities and at-risk situations through the implementation of the life-saving rules. We never, again, had a year where we had 9 fatalities. A few years we went without any, but unfortunately we've had a few in between. But there was a severe reduction in the number of fatalities that were occurring, and a great reduction in the life-impacting risks that were taking place, because the incident management tool that we put in place, we also tracked whether or not a life-saving rule situation was present, and we were able to track a high number being observed and then them gradually reducing because they were being managed out and engineered out, and the awareness was increasing on that. The increase in the visibility of HSE performance globally was very impactful. We now had tools where the managers could go and see the dashboards and see where the concerns were and where we were making progress. So we now had a global tool where everybody was reporting in on the same types of incidents. We were comparing apples to apples, and we were able to track and trend the decrease of lost time incidents and total recordable injuries. And over the 5-year period after we implemented the incident management tool, we saw over a 50% decrease in both our LTIs and the TR, the total recordable incidents, over that period of time. Whereas before, we didn't have any visibility at a global level. So this was a great benefit because managers could see that it was making a difference and that people were reporting and managing things and effectively managing them by managing the risks that were out there, by tracking the number of corrective actions that were being closed, and also tracking the types of corrective actions. So we had a breakdown of the percent of corrective actions that were elimination, substitution, engineering, administrative controls, or PPE. And we always were striving to drive towards the elimination, substitution, and engineering bracket versus the administration and PPE. So we were visibly tracking those as well to make sure the corrective actions that were being implemented were at quality level. The global management of safety data sheets with one software system saved over $250,000 in annual costs. It reduced our fines. It actually eliminated the fines that we had received in the past with improper shipping and labeling. So that was resolved, and that issue wasn't a concern anymore with that effective use of that tool. And the global management of the HSE incidents, it was just consistent across the board, and people were reporting, whereas in the past, there was a culture of not reporting anything unless it was a fatality, something that they absolutely had to report. And then it was a change for many countries that don't have regulatory requirements for reporting, that this global expectation was now in place. So, we could now compare different countries against each other's performance because they were all expected to report on the same types of incidents consistently. The IH and medical surveillance software system also gave more global visibility to that aspect of managing HSE. They had been running kind of blind on that with no industrial hygiene program whatsoever until I was put in charge of their industrial hygiene program and developing that. And based on that focus and the tools that we put in place, the different business line managers had a greater understanding of the risk in their business lines and how to manage it. So for example, we were able to show them the results of the industrial hygiene monitoring data, and they could see very clearly that there were concerns and issues with silica exposure, lead exposure, and noise in certain lines of businesses in certain countries. And then they could also see, after we implemented engineering controls and some other controls like PAPRs for the lead operations, where some of the engineering controls were limited, there was a dramatic reduction in the exposures after doing the controls. There was a dramatic drop in the level of silica people were exposed to, and then a dramatic drop in the blood lead levels that were being monitored after implementing those controls. So they could actually see where the problems were, what the controls were that were implemented, and the effectiveness of those controls through the systems that we put in place and the visuals that we created for them to understand the problems that they were having in those different areas. We also implemented a global audit program as part of the HSE management system, which gave us a really good idea of the gaps that were identified for compliance purposes in the different locations. And it also allowed us to see the status of the globally applied corrective actions, like I said before, about the hierarchy controls. And it provided assurance with the upper level management that we were continually improving and continually managing HSE risks in the company.